All this is Dr. Mobeen Sayed. Welcome to one more show. So the discussion today, there are lots of things. I was absent for a few days because of my wife's birthday, and my son had been over. We had a lot of good time. We surprised her as well. But because of that, I had been absent, and so lots of information has piled up. So we're going to start with a few important things today, and after that, we will continue our discussions from Monday onwards. One request: if you do not like CDC's data or if you do not trust CDC's, I am going to discuss a bunch of CDC data today as well. So, heads up. I think that we should look at data wherever it is and then make up our minds and our decisions and our thoughts. We should not shut down data wherever it is. We could say, hey, I don't trust it. That's fine, but we should see what it is. So let's start with our hot breaking news, and that is the boosters. So CDC claims that they have made the boosters simple by making everyone eligible. So far, as long as the decision goes to people to decide instead of it becoming a part of the vaccine passport, I think it might be okay. That means they say, hey, if you have uh, taken Moderna or Pfizer and it is 6 months, and if you want, you can go get the booster as well, because that would ramp up your immune system once more and add to the protection. Fine. But I hope it doesn't become part of the passport to say you must go and get the booster. So this is one interesting thing. The other interesting thing, which is a tiny bit of a levity here, CDC continues to encourage the 47 million, read here, 47 million adults who are not yet vaccinated to get vaccinated as soon as possible to protect themselves. And my apologies, I'm a little congested. We went out to San Francisco and had a bunch of temperature differences, but I have tested myself, it's not COVID. Okay, so CDC continues to encourage the 47 million adults. So 47 million adults left to be vaccinated. Do they recognize this 48 million folks group? Is that group part of this group that is being declared unvaccinated? I am sure that there is a large group, or I do not know, large or small. There is a part of this 48 million who were infected in the US, and out of them, 38 million have recovered so far. I'm sure that many of them or some of them have gotten vaccinated as well. But what is that number here? Does that number, this 47 million, include them as well? If it does, I would be a little bummed about it. So that is one hot news. This is today's news, and the advisory board unanimously approved it. Now, moving on. The second important thing is the herd immunity and the possibility of herd immunity. And you may have seen that we started with, hey, we need about 70%, 66 to 70% of the population to be either infected or vaccinated, or basically to have the protection or antibodies to develop herd immunity. And again, we all understand this, that herd immunity is a theoretical milestone. It doesn't mean that those remaining 30% will just magically be safe, but their protection would increase because there is a wall of 70% of the people who are infected, and the virus would not have a chance to continue spreading from one person to more than one people. Remember, herd immunity's basic idea is that one person infecting a number of other people. So if it is more than one, the R naught reproduction number, if it is greater than one, that means the disease is spreading in the community. If it is one, we call it stable. That is, it is going from one to the next one instead of spreading uh, at an exponential rate, for example. And if it is lesser than one, that means it is winding up. So the herd immunities concept became changed. And let me just very quickly, I have my board here as well. If I can quickly draw this as well, we had looked at this. Herd immunity equals R naught minus 1 divided by R naught. Or another way is 1 minus 1 divided by R naught, whichever way you want to write. So if let's say the original virus had a reproduction number of 2.5, that means from one person, another 2.5 persons will had a chance to become infected. Then the herd immunity would have been 2.5 minus 1 divided by 2.5, which means 1.5 divided by 2.5 was the number of people needed to be to have the protection to develop herd immunity. Then the alpha variant came in, and that was more contagious, faster. And then delta came in, and that was further faster. And so now there are many numbers for delta, and I think in various communities these numbers are valid. There are some communities that say delta has a 4 of the reproduction number. That means one person makes 4 other people infected. There are some communities that report up to 9 as well. So I'm going to use a number that is here, which was in, I believe it was here in the Yale, and they had said anywhere from 4 or so. So in these three references, somewhere in here, I took a number from here. Let's use 4 for the time being. So 4 means 4 minus 1 divided by 4, that is 3/4, right? So 3/4, or about 75%. And you would still hear scientists, researchers, people saying that, hey, anywhere above 60% or 60 to 70%. You would then see people saying 70 to 80%. You would also see people saying 70 to 90%, and so on. Let's consider for our discussion greater than 70% to be the herd immunity milestone. It's a good milestone to have. And that is what I really wanted to talk about today, and a couple of things to see there. First of all, start from here. I'm revisiting this one, but if this 47 million adults also include those who were infected and recovered, then really in the adults population, we have a very high percentage of people with the antibodies, either because of the infection or because of the vaccine. Totally agreed that there are some people who had the infection last year and their antibodies may have been waning, but we also understand that antibody waning is not exactly equivalent to no more protection. Similarly, vaccines also have antibodies that they generate, and then some of the vaccines, for example Pfizer more prominently, they start waning quicker compared to Moderna, and that would reduce their efficacy. But does that mean that our body just doesn't know the virus anymore? That is not true. That our body is exposed to the virus. So this 47 million, let's use half and half. And again, I may be totally wrong here. This 47 million, all of them may be non infected and recovered, and all naive, their body immune system naive to SARS-CoV-2. Or there may be a mixture. If that is the case, we may be at herd immunity. So now I want to go to the next point. And again, I would say this: we may be at herd immunity. That doesn't mean everybody has become safe. That simply means an important milestone is reaching where the one person who is infected may not be able to spread it to more than one people. That's the basic idea. So the disease would be slowing down. And I had done this discussion before, that will COVID come back more deadly? And I think it would not. So here are some discussions around the herd immunity. I'm just going to leave these links over here. Now I'm going to go here. This is the CDC's tracker. So I'm happy that eventually with Israel, UK, we also have US data tracker available as well. You can download this data. You can criticize this data. You can say wrong, this data is, or right. But still, there is at least a place where there is some data to go and check. And if you feel that there is another place where there is better, more authentic data available, I would love to see that as well. So I am looking at the data which is available. So check this out. This is their home, tracker home, and I'm going to go here. This is very interesting. So all of these data points are actually interesting. Let me, it's it's not the most polished system, but it is a good system. We have the data here. So two ways CDC has shown seroprevalence. So if you go and check this out, on the left side you would see antibody seroprevalence. Do you see here on the left side? Antibody seroprevalence. That is the presence of the antibodies in the serum of the person who may have been infected before or in fact vaccinated. And there was a very interesting thing that I saw. I want to show you this. At least for this site, do you see these two blue bands? The darker band is infection induced seroprevalence. At least on the CDC site, there is a recognition of the seroprevalence or antibody production because of the infection. That fact cannot be denied. And then the lighter blue is the combined seroprevalence, that is infection and or I would think and as well of the vaccine. I would have loved to see four categories over here. Again, beggars cannot be choosers. We got this data, and I think that itself is awesome. Maybe we can download this data and do further processing. I would have loved to see seroprevalence or all of this data over here: cases, hospitalizations, death. Number one, in unvaccinated, who are just one second, I'm seeing that there is a issue with, okay, so Twitch somehow may have blocked our discussion. That's fine. Continuing. So number one, I would have loved to see totally unvaccinated. Let's call them SARS-CoV-2 naive. Their immune system does not know SARS-CoV-2 in any way, by a spike protein vaccine or by the infection. That is one group. The second group should have been vaccinated, which we are seeing here. Third group should have been infected only. And then fourth group should have been infected and vaccinated. And if all of this information was present in these four categories, we would have had gold mine over here of scientific data to analyze and look at. Although I think from CDC's point of view, there is just two basic lenses: not vaccinated or vaccinated. But here in this graph, it is interesting that a third lens of seroprevalence because of infection is shown. So that was very interesting for me. So if I go back up here, what they have done is they have done seroprevalence data study. Where is it? On the left side here, antibody seroprevalence. They've done it in two ways: blood donation sites. That means when we go and donate blood, that site looks for antibodies as well. And then from there, what is the seroprevalence or antibody production presence in how many people? Now the question you can ask is, how does a blood center know that this is a person who was vaccinated, or is this blood coming from someone who was previously infected? How do they differentiate between them? And it's actually very simple. If I go to my drawing board, clever and simple. So please, this discussion, don't take it as if I don't have my criticism of CDC's approaches, but here is some data that I'm excited about to see. So look at this. We know that somebody who becomes infected, right, with the actual virus, that person will develop this is the virus. These eyes that I make in things have made people declare, agencies declare, that my lectures are not even worth. Anyways, so back here, the virus is here, and if somebody is infected by the virus, then they will make antibodies not only for spike protein, but they will make antibodies for nucleocapsids as well, and protein too. and M protein as well, and other parts of the virus as well. So if, let's say, I was infected and recovered and I donated blood, and they ran an antibody profile on my blood, and they found antibodies against N protein or nucleocapsid protein, then they know that I was infected. Why? Because if I had the vaccine has spike protein in it. Vaccine does not have, at least the vaccines today in the US usage, not an inactivated virus vaccines. The vaccines that are used here, they only have spike protein. So the antibodies produced will be against this spike protein only. Correct? So if you find someone and their blood has N proteins, antibodies to N proteins, then that means they were previously infected. If you find antibodies against only the spike protein, then you know that they were vaccinated. So that is how they could differentiate. Now, somebody who is vaccinated and was infected as well, they cannot really differentiate other than asking them this question. The reason for that is that a person who was infected by the virus will have antibodies against spike protein and antibodies against N protein and antibodies against other parts as well. So then to be able to say that this antibody was for vaccine or not is not possible. Okay, so going back here. Now, I think you would like this one part. So we are now talking about seroprevalence that is observed in the blood. And if I go here to, this is Alabama. I hope I can change this to here. I can change it to study wide. That means the whole US. And you can actually go and change it to your state and see what is the not herd immunity, seroprevalence in your area. So here, this is US wide blood donation centers looking at people's antibody. Look at the number, 91.8%. Again, can we take that and say the whole US is that way? No, because there are many limitations and they have their limitations too. But it makes sense. Not everybody goes and donates blood. And so not everybody, the sample is not reflective really truly of the population. Still 91.8%. If we were able to reduce it, bring it down to say above 60%, I would even take that to say we are in a good shape. Now if I take this piece of information and put it in parallel to this information, that 47 million people are left to be vaccinated, and then put that with this information that 38 million have become recovered and another 10 million are now going through the process. Unfortunately, some have died. A lot have died. Then if you see the numbers, it really looks like a smaller segment, which means it is possible that the herd immunity is actually reaching a higher threshold, higher level. So back here. So this is one area which I really thought was very interesting. What do you think? Do you feel that with this, we are reaching a point where it is going to be 1-to-1? That means from one person to one. If it starts reducing below 1, then it is even better because now it is going away. Staying at 1 is stable. More than 1 is spreading, still spreading. Okay, continuing. Then they have one more way of looking at the seroprevalence. And again, this is on the left side here. The other way is lab seroprevalence. What does this mean? I go to lab for some blood work, and labs can de-identify data. So the data is not identified. If you see here, it says somewhere that this data that the labs are looking at and providing CDC with this information, this data is de-identified or unanimous data. Sorry, anonymous data, not unanimous, anonymous data. So what the labs are doing is, and they're not looking at all samples. This almost seems like somebody was listening to me. I had been saying that we should go and collect the blood samples and look at them on weekly basis and create a profile of how the country's prevalence is doing. And here is what they're doing. They're taking, I believe, bi-weekly some samples from all states and then collecting them and seeing the seroprevalence. From there, they're kind of creating a seroprevalence map as well. Now, this map is based on the blood collected in the labs for other tests. Again, this has its own limitations because we all just do not go to a lab and say, please take my blood. We go there for certain reasons. And so there may be a bias here as well. We all do not donate blood as well, so there is a bias there as well. So these are not 100% the accurate pictures of the society. If that is what we were going to do, then we should have stood there somewhere in the streets in every state and in multiple places and started, meaning a well-designed study should have been there, but still this data is decent enough. So here, with this data, the seroprevalence is very different. And again, please remember, these are the folks who go to a lab and donate their blood, not donate, give their blood for some lab tests. Seroprevalence estimate is 29.4%. So blood donors, 91.4 or something. And lab, so the blood donors, 91.8%. Folks who are going to labs for whatever random needs, 29.4%. If I'll go back again, I'm matching this back here to say that it is actually very interesting to see that we are almost reaching a point where, at least from a exposure to the virus, either through the infection or the vaccine, and I'll keep repeating it, I think it is, you are probably aware of this, I say this every time, getting infected is not recommended. It is a difficult thing. It damages the body and then it can cause death as well. So whichever way somebody has developed the antibodies, that number is getting really high up, number of people. Okay, continuing. Now I'm going to switch gears from the seroprevalence. So far what I would request is that we have wrapped up one part of the topic, that I think we are reaching very high up on the seroprevalence and herd immunity. I believe that the infection rate would now slow down, not just because of the seasonality, but generally slow down as well because the population is changing. Now, there may be a change in behavior of ours. We might say, hey, everything is good. Or let's say the holidays are coming. Our changed behavior may cause surges, but we do not have a lot of people to cause surges in. Having said that, I'm going to put one more point in here. Now we would see surges in vaccinated or previously infected and reinfected, which so far the data has not shown. And I'm hoping that those surges will be really tiny. These will be really smaller, fewer number of cases. And if people started getting their boosters as well, again, I am not saying go take a booster or not. I am sitting with my family to decide, should we go get our boosters, because we have gotten our primary series, all of us. So that's a different discussion. But let's say people have gotten the boosters too, which made their immune system ramped up once more. That would mean the infection is going to go down and stay down for a very long time now. So even if the boosters were not there, I still believe we have decent protection in the society. And then if I go back here for one last comment, and then I'm going to move on to the next topics, and that is 47 million adults. Of course, there are children as well, but generally children have a better outlook as well. So that community, although out there, is more resilient towards COVID. Okay, changing gears now. I also wanted to look at some other things here. Now, this is rates of COVID. So this all is on the CDC site, and it would actually be very interesting for you to go check this out as well. For example, and I'm sure that you're already looking at it, there is pediatric data, there is pregnancy data, there is vaccination delivery and coverage, there is cases, deaths, testing, demographic trends. That was very interesting. I was looking at that. the trends by sex, by age, by race, by ethnicity. That was very interesting. Healthcare settings, variants and their prevalence. So I'm going to go over some of those, the ones that interested me. But there is a lot of data here. This was a this is rates of COVID-19 cases and deaths by vaccination status. So I would once again say the same thing. And if anybody from CDC, I doubt they're listening, but if anybody is listening or can give them this message, four groups should have been here, should be here. Number one, SARS-CoV-2 naive. Number two, vaccinated. Number three, previously infected. Number four, previously infected and vaccinated. This is mostly hospital data, and these questions can be asked in the hospital to say, are you vaccinated? Did you have an infection in the past? So here we only see CDC's lens, two things: vaccinated, unvaccinated. And what I do not know is that these folks here who were infected and recovered, where do they sit in this group? My suspicion is they sit in unvaccinated, which I think would be incorrect. But anyways, maybe they are in the I don't know. So here, if you see, this is the unvaccinated versus vaccinated cases, which are, so if you see here, rates of COVID-19 cases by vaccination, it's cases. And so here in August, unvaccinated person had 6.1 times greater risk of testing positive for COVID-19 and 11.3 times greater risk of dying from COVID-19. So unvaccinated folks, anybody who is not yet exposed to it, they do have a risk. Then you can look at it with age group. We saw this group, this data once before as well. You can see it with the vaccine products as well. So Janssen, Pfizer, Moderna. Moderna is the most robust, then Pfizer, then Johnson and Johnson. It's an interesting table. I want to continue to move, and I would request that you look at some of this data as well. Here, this is the trends in number of COVID-19 cases and deaths in the US reported to CDC by state and territory. So here, this is just that same thing as we see on the worldometer, the waves. So you see that there is a tiny bit of a wave that is occurring again. The question is, will this now become a bigger wave? Number one. Number two, will these cases be in vaccinated now? Because as the number of vaccinated or previously infected as well, that group that has antibodies, as that groups continues to become bigger, any further exposures are going to be in that group. I want to continue to this one. Rates of lab confirmed COVID-19 hospitalization by vaccination status. So this is once again, I would have loved four groups over here, but we have two groups, vaccinated and unvaccinated. So here, this is the age adjusted rates of COVID-19 associated hospitalizations by vaccine status in adults aged greater than 18 years of age from January to September 2021. And if you see here, for example, if I look at the last part, rate in fully vaccinated persons is 3.8. And I believe this is per 100,000. It would say somewhere over here when I was reading it. I think it is per 100,000. So in the, yes, it is right over here, rate per 100,000 population. So unvaccinated folks, 44.8 folks hospitalized per 100,000. And vaccinated folks, 3.8 hospitalized per 100,000. So that is almost 10, 11 times difference. And then they have according to various ages as well. And I would once again request you to look at it. It is just interesting for me to see some of this data available. Now, this one, COVID-19 vaccine effectiveness. And if you see here, they say that we have various systems in which we are collecting data, IV, supernova, vision, and this is about hospitalization. And so this chart is a little clunky. You have to click outside of it and then bring your mouse in. And then when that line appears, you have to stop. So I didn't stop. I have to come back here and stop. So now August to September, vaccine effectiveness 88% in IV system database, and confidence in 95% confidence interval 85 to 90. Supernova, July to September, 83.1% effectiveness for hospitalization, 76 to 87%, 95% confidence interval. So then if you look here, vaccine effectiveness against infection, so cases, or reinfection if you say, but again, vaccine is not considered as an infection, so shouldn't call it reinfection, re-exposure. So if you see here, 58%, 58.6%, and 66% at July to August timeframe. If you see before, it used to be 69.6% and 91.0% infection, so cases. So that efficacy has dropped, and they have a footnote over here, footnote or a note here, that this is dropping because time has passed since people got vaccinated and Delta became the predominant variant during this time period. So again, is it because of that? Is it because of the, I don't think that this is just as cut and dry as time has passed. There are people's behaviors, there are social norms, society is opening up, not opening up, lockdown, not lockdown, children going to school, not going to school. There are so many factors, not just two factors. And I will put this in front of us for that, so you don't think it's just Mubin saying it, how Delta variant has affected our ability to reach herd immunity. And if you would see, there are many, many factors in these three references. One, two, the false promise of herd immunity in nature, and third, the Yale medicine, how is the vaccines protecting us? But there is more, right? So these three links have the data about the effectiveness against infection of a vaccine or a previous infection, and the controls are not just vaccine and time. There are more than that controls. But anyways, that is what CDC decided to say. Continuing, this is also a very important chart. And this is an interesting chart because nowadays we're talking about there is going to be a new variant as well. I know that we are kind of sitting scared to say there will be one more variant. There are many, many variants all the time. Hopefully, there would be nothing like Delta. I don't think that we can sustain another wave globally. So, I just wish that the Delta would go away and then we're done. So, here, apologies. So, this is the prevalence of various variants. So if you see here, this is variant of concern B16172, that is Delta. And then 99.9% is Delta, and this is week ending of 11/13. It is a good thing. I mean, well, the virus itself is not a good thing. It is killing us, it is damaging us, it is causing so much, not just health issues, but socioeconomic issues, political issues. People are getting divided, they are attacking each other. It's just horrible situation. It's an evil time at this time outside. However, I still feel that we cannot sustain one more variant that takes over Delta and has a higher reproduction number and starts all over again. That would be terrible. So Delta is 99.9%. So that was also another interesting data point here with the CDC. Then we're reaching almost at the end of it. This is the integrated country view. So this is overall view of the country. And what they're doing here is This site provides an integrated county view of key data for monitoring of the COVID-19 pandemic. So you can actually hover your mouse over various counties and you can see community transmission in that county to be greater or lesser. So you could go somewhere and say, for example, these red ones are high, the yellow ones are low. So, for example, Grant County, Oregon, moderate. So, total 362% of the community, I would believe 11.24%, percent change is 0.96, and so on. So, you can see how the transmission is occurring within the country. And finally, one more thing which I had stopped here, but I wanted to go state by state as well. And then I found out I could not cover so much. So I just opened up Texas so far, and I have to understand more about this one. But here it says, and one of the cool beans had actually sent me this study as well. I have not yet fully reviewed it, but it says here in Texas, overall, if you see here, 13 times higher unvaccinated versus fully vaccinated overall crude case rate by vaccination status. This is Texas, January till October 1, 13 times higher at this time. And then overall crude death rate, daily 7-day moving average by vaccination status from January till October 1st. And it is nowadays in this area, this is August, September, really September and October, 20 times higher. This is Texas Health and Human Services. I have to go over this data a little more. If this is the case, it looks concerning. I need to look at this data. So, this is the discussion for today. Thank you very much for being here. Just a quick update for my son came over. I went and brought him. Uh, when I came back home, fortunately, my wife was out. My other son had asked her for some fun food, so she had gone out to bring some groceries. And so my older son, who was flying in for a surprise, we could sneak him in, and then he sat in a room, and then when my wife came back, he surprised her. There was a lot of good time. We then went out to San Francisco. As you can see from here, from my voice, I became a little congested. We went out to San Francisco and we had a lot of good time. uh, he's going to fly back out tomorrow morning. I think we have to go to airport at 5:30 or so. So I'm gonna not do a chit chat today. I'll spend some time with him. Tomorrow is going, plus we'll sleep a little early as well. So with this, thank you very much. Thank you to everyone who sent in gifts. Thank you to everyone who had sent in good wishes, good prayers, and please stay safe, happy, and healthy. I would see you on Monday. Have a great weekend. And if you can support this work, please like, subscribe, and share. And there are links in the description. You can be a patron, you can buy me a coffee, or you can use PayPal. Thank you very much. I'll see you on Monday.